COVID has been an interesting scenario for everyone. And we had this seminar back, I think it was the end of March, if not very early April. And of course, at that point, we did not have a lot of community spread. So it was more hypothetical types of scenarios that we were talking through. But now that we have pretty substantial community spread, Amanda, Joe, and I are getting a lot of questions from our members on, someone's getting tested and they're going to be out for a certain amount of days, or someone's been tested positive. What do I do? Or the kids' daycare has closed, or now that school's starting on August 24th, let's say a class has to quarantine and now they have to quarantine for 14 days. And what does that happen? So how employers should handle that. And the Families First Coronavirus Response Act did pass back in March and last through December 31st. So we thought it would be a good idea to go back to our partners at CertiPay, who have been so wonderful to share so much information with us through this crisis. And Rachel had that webinar then, and so we asked her to come back and give us a refresher. And so that is what we're going to do today. So like I said, we'll go ahead and turn it over to Rachel to get started. But if you have questions, you can throw them in the chat. Or you can wait until we open it up for questions, but I am going to mute everyone just so we don't have any background noise. And remember on chat that if you don't select a specific person, it's going to go to everyone. So just Zoom etiquette there. I had a whoopsie with that. AJ will laugh at me, but just remember that it automatically defaults to everyone unless you're particularly messaging one person or the other. But all right. Rachel, you good to go?
Yes, excellent. Thanks, Katie.
Absolutely.
All right, and a quick reminder, just so you know where to find that Zoom group chat, you can scroll your mouse all the way to the top, look for that black bar, and go all the way to the right side, find the word more, and then first line under that will be chat, and that will open up your Zoom group chat so that you can ask questions there or put comments in there if you want to. And so as Katie said, we're moving through this pandemic at warp speed because it feels like March was 2 years ago. And so here we are now. We do have community spread. We do have scenarios that are very real. So it makes sense to kind of address this. So let's take a look. I'm Rachel Camella from CertiPay, and I'm happy to be with you all today. So thank you for joining us. So I'm going to do a quick recap. I know you guys have all been talking about this, but let's just kind of recap for a little bit what we're even dealing with. The FFCRA is the Families First Coronavirus Response Act, and it is for all employers under 500. And with the first part, it doesn't matter how many days somebody worked with you for the sick pay. But for the expansion, there's a 30-day minimum, and it's at the time of request. So even if you just hired somebody new, 30 days from now, they would be eligible for that expansion piece. We'll talk more about that. And you have 80 hours of sick pay, and they're calling that first 80 hours sick pay regardless of what it is, and we're going to break that down too. And then an additional 10 weeks after that, specific for child care issues connected to COVID-19. If somebody is out for individual reasons, they are sick, they've tested positive, they have symptoms, it's for the actual person, the eligibility is for full pay, up to $511 a day. If they are out to care for somebody else, so they're caring for another person who's sick, or they're caring for a child whose school is closed, 2/3 pay. And that is a $200 a day cap. I just want to touch on, those are pay caps, but in addition, you also get the tax credit for health care for that individual. If you pay a portion of their health care, then you can get a credit for that portion as well, along with the employer's share of Medicare tax. So don't forget, when you're preparing your tax credits connected to FFCRA, add the other components in. Don't miss out on those tax credits as well. So digging in a little bit more, talking about the recap, the employee has been quarantined or told to quarantine. So this would include, let's say somebody travels to a state where when they return, the state guidelines are you are required to quarantine for a number of days, that counts as being told to quarantine. So that individual would then qualify under FFCRA for that. An employee is advised to quarantine because they have symptoms and they're seeking medical attention. These are all reasons for the individual who would be eligible for full pay, capped at that 511. And for the 2/3, they are caring for a sick or quarantined person. So if they're caring for even an elderly parent who is sick, who they care for, if they're caring for a child who's sick, if they're caring for a partner or significant other or spouse who is quarantined and they have to care for that person, they would be eligible for that 2/3 pay. And then an employee caring for a child whose school or daycare is closed. And keep in mind, the school or daycare child care provider can be whoever that is. So if the child care provider is your mother-in-law or your neighbor or somebody else, that child care provider, if that child care provider is no longer available, that counts. It doesn't have to be a daycare center or an actual school. If the child care provider, whoever it is not available, then that person is eligible for the 2/3 pay. One thing I want to add here is the FFCRA credits are limited to these numbers, the 2/3 pay and the 200 cap and 511 cap, but that does not mean you can't pay them more. So let's say somebody is eligible for that 2/3 pay, you are allowed to pay them the full pay, you just can't take credit for more than the 2/3 capped at 200. How we doing? Any questions so far? All right.
And feel free to unmute yourself. You should be able to unmute yourself, guys, if you have a question. So, and then we'll just ask that you mute yourself back once you're done.
Absolutely. So paid leave versus layoff versus somebody chooses not to come in. These are the kind of common scenarios that we're seeing. So when you think of an actual paid leave or the FFCRA, that means your business is open, operating, functioning. You need employees. You need them to work. You have work available for them. But the employee is unable to come in due to one of the COVID-related scenarios that we just talked about. This is when paid leave kicks in. So it's a very clear line. The business is open and operating, but the employee can't come in because of COVID. That's when paid leave is most likely going to be an issue or eligible. Now a layoff, so the business is closed. You've been ordered to close, you're closed because of lack of business, you're temporarily closed, whatever it is. If your business is closed, then your employees are not working. They don't have the option to work, but they're willing and able to come in. Now we're talking about what would be called a layoff or a furlough, and those employees are eligible to apply for unemployment. So it's very clear, either you're open or you're not open. And then that's a clear line of paid leave or eligible for unemployment. Should be very clear. And then the last piece there is you're open, you're operating, and your employee doesn't want to come because they don't feel like it's safe. Now they're choosing not to come. You're open and they're choosing not to come. They are not eligible for paid leave. They're also not eligible for unemployment. So that creates an issue there with, that employee is just not comfortable coming in. They don't necessarily still have a job in that case. So something that, you want to cross that bridge. If somebody is telling you I'm not coming back to work or I'm not comfortable coming in right now, that's fine. You have choices as a business owner. Do you want to just consider them on temporary leave, or do you want to allow them to use up all their PTO? You have choices, but they're making the choice not to come in. It's not that they have been told to quarantine or that you're closed and they're on furlough. So when it gets down to that point, you have options about what happens with their actual job. Okay. So the payroll tax credit, I talked about some of this already, but it applies to all of the pay where the people qualify under the FFCRA. So that sick pay, the first 80 hours, or the expansion in FMLA. And so even though the sick pay, I'm going to pop back to this slide here. So under the FFCRA, the very first 80 hours, employees might be out because their child care centers are closed. That's still the first part, that 80 hours of sick pay window. And so if somebody uses the first 80 hours because their child is on child care or they don't have a child care provider, they don't have that 80 hours to use for any other reason. Once you use that 80 hours, it's gone. And then you've got the expansion piece that kicks in an additional 10 weeks. And so that's where this credit is. It's 10 more weeks under the emergency FMLA expansion. All of these wages can be credited against your federal taxes due. And like I said, don't forget to add in the employer's portion of any healthcare paid, as well as the employer's portion of Medicare tax. So add all those bundles in when you prepare your 941 for your tax credits.
Hey, Rachel, we got a question that came in on this. What is the date the effective 80 hours policy came into play? Was that from the date this bill was passed in March, or when was that?
It was from the date the bill was passed, and it is in effect until all the way at the end of the year, December 31st. And so you have, think about it. That's one of the questions that we get is what happens if somebody used the 80 hours back in April, and then they actually get sick and test positive for COVID in October? Well, they already used the 80 hours, so they are not eligible to use that again. Once you use the 80 hours, you only get that one bucket. And then, and we'll talk about that too. I have another slide about that, but they have other options.
Okay.
Did we answer that? Okay, so the expansion applies if one of these cases is true. So school or place of care is closed due to COVID-19. Child care is required. So there's some debate between the DOL and the IRS of what age is that. And, 14, 16, 18, high school, junior high, it's kind of the way the DOL has broken it down. And the DOL is the one who's determining that is child care required. So if you have a special needs teenager where child care is required, then that makes it eligible. But if you've got a 16-year-old who otherwise would not require care, then it doesn't apply. So is child care required? That's kind of the question we ask. And somewhere around that, in a normal healthy child, it's going to be around 14 years old. High school kids don't need a whole lot of extra guidance. So it would be more like for younger kids unless there's a special needs situation. Employees unable to work or telework because they are the one providing the care. So also they're the only one who's available. So if you've got a parent who is in an essential position, then that parent would not be able to stay home with the kids, then the other one would have to. So there's so many things you kind of look at and break down, where is the eligibility? Is the employee able to telework? Is working from home an option so that they can manage this? Or do they have to stay home and provide the care? Then that expansion would kick in.
Rachel, I've got a question. So,
yeah.
And this kind of goes into the examples a little bit. So let's say, the bill went into effect April 1st, I believe it was. So, and I don't know if you can confirm that or not. I know a lot of it was as of April 1st when the rules came out from the Department of Labor. you know, let's say the stay-at-home order went into effect April 1st, because that's when I went to the hospital to deliver my baby. So it's ingrained into my mind. But so let's say the business closed for the stay-at-home order and determined that they would pay their employees while the business was closed. You know, a goodwill, wanted to make sure they were taking care of everybody. And then the employee, after they reopened and everything, the employee decided not to come back for 2 weeks. And the employer, because of taking care of a high risk individual, not somebody who had COVID or anything like that, but it was a high risk individual. Did you have to be explicit in saying, hey, you're using your 80 hours of this act, or by virtue of paying them that additional 80 hours, did you essentially meet that requirement?
Yeah, so this is exactly the kind of scenarios that we see quite frequently. And when I talk about choice, saying that you cannot work because you're choosing to care for a high-risk individual or you feel like you're high risk is not a qualifying factor for FFCRA. So when somebody is caring for an individual who is deemed high risk, that doesn't qualify. That would be considered a choice. They're choosing not to work and therefore not eligible for those 80 hours under that scenario. Now, let's take a couple of examples. Let's say, for example, the CDC made a recommendation that anybody over the age of 65 stay home and self-quarantine. That is a CDC guideline. That is not eligibility for FFCRA. It's a recommendation by the CDC. If an individual who is over the age of 65 was directly told by their healthcare provider, you need to self-quarantine. So now they are directly told by somebody to self-quarantine, that one person would qualify. But blanket statements and recommendations do not count as eligibility for FFCRA. And with a high-risk individual, let's create a scenario where that one would be eligible. So let's say you have a high risk, you have somebody who is high risk and may be exhibiting symptoms, and the healthcare provider says it will be important for you to self-quarantine so you do not create additional exposure for this individual. Now that one person has been told to self-quarantine. So that's an example where it would be, that person would be eligible for that 2/3 pay caring for somebody else. But blanket statements and high risk categories, those are not eligibility for FFCRA. And also cases where I can use that same example that you gave us, because at the beginning they were still closed but continued to pay the individuals. So they're just making the choice to pay people. So that's not FFCRA. That would actually be the ERTC, which may or may not be for this webinar, but when you choose to pay the employees even though you're not open, that's not FFCRA. FFCRA applies because you're open and operating and the person can't work. Did I create additional questions with the answer to your question?
Let's see. There was a question that came in, but go ahead and keep going and I'll go back to this question once I read it.
Okay, so I've got some examples here. You've got a 5-year-old and an 8-year-old, and they're home because their school is either closed or is remaining virtual. This is an example where FFCRA, the family child care expansion would be intact. So now you've got your first 80 hours. Let's say they didn't use it for any sick pay. They're going to use those 80 hours to stay home and care for these kids. But then you've got that extra 10-week expansion. But maybe you only need to use part of it. They can use that in an intermittent basis. You've got 10 weeks worth of pay that you can use. Let's say your employee only works Monday, Wednesdays, and Fridays, then you can apply the intermittent leave for that. Or maybe they can alternate with a second parent so that you've got Monday, Wednesday, and Friday, you're going to apply expanded FMLA, but Tuesday and Thursday, they're going to come in and work. So you can split that 10-week expansion up any way you need to. And so have a conversation with your employees, even though they're like, my kids are home, childcare is closed. That doesn't mean that's the end of the discussion. Have a conversation like, how can we figure this out? How can we work it? Do you need the whole day? Do you need part of the day? What can we do? So you have options, but communication is going to be really important. Talk to these people and figure out what's going on and how can you work it out, so that you still have the benefit of your employee working and doing some things, but you're helping them. They can still care for their kids and figure this out. Keep in mind that everybody's in a pretty challenging boat right now. And so have the conversation. Don't be afraid to bring it up and discuss it and figure out how we can have a win-win all the way around. So another example, you have an employee who is out on FMLA. She just had a baby, and she's scheduled to return in August, but the nanny or the child care provider that she was going to have is no longer available due to COVID-19. Her spouse has an essential job and cannot stay home with the baby. So now this individual, you're open and operating, you want her to return to work, but she can't because of a child care issue. She is now eligible for that FMLA expansion piece. So again, something you want to work out, how can you figure out how to maneuver through those waters where, maybe you just have to pay that window of time, get her through the next 10 to 12 weeks until she can figure out another plan, or maybe you can do something intermittently. And keep in mind, all of these dollars you're going to get the credit for on your taxes. So you don't have to be too scared of doing that.
So Rachel, we had a couple questions come in based off of this slide, and they might be addressed. But one would be someone who is self-employed, who had to stay home after April 1st through the end of the school year to take care of their childcare, to take care of their grandson. So would they be eligible for the tax credit and also have not needed to pay Medicare tax?
So let me see if I have this right. So a self-employed individual who pays themselves as an employee would be, so you have to have at least one employee. So if you're in a self-employed structure, but you are paid as an employee and now you cannot work as that employee and you have to provide childcare for somebody, then yes, you would be eligible to take that, though the pay for that individual as a tax credit. Okay. Did I get it right?
Yes, I think that that applies to that individual. And then one other question in terms of seeking medical treatment for someone who believes they may be infected or experiencing symptoms, and they go to the doctor, they get tested, but as we know, depending on what lab you get tested through, it takes anywhere from 10 to 14 days, 7 to 14 days, whatever it might be, to get your test results. So if the employer gets documentation from the employee's doctor that the employee's experiences the symptoms and needs a quarantine, that would meet the documentation standard or kind of the intent of this bill?
Yeah, so first of all, there's no documentation standard. They're asking us not to seek that kind of documentation just because we don't want to bog down the medical industry with, hey, I need a doctor's note. So, but again, this is a really good example that we're seeing quite frequently. And I think I have a slide with this exact example in it. And it's, and the qualification for FFCRA for full pay is that you are experiencing symptoms. So any of the COVID symptoms, you are experiencing symptoms and you are seeking care. So it doesn't say under that piece of it, you have to have a positive test result or you even have to go get tested. But you have to have those two parts. You have symptoms and you're seeking medical attention. So that individual, all they have to do is tell you that. I have a cough. I've had a fever for the last few days. I'm exhausted. I have no sense of smell or taste. And then first thing there is do not come in End of discussion. Next thing, I'm going to the doctor, or I called my teledoctor. They can send you a screen catch. If you even have one inkling that maybe it's not true, just say, you know what, just send me a screen catch of your conversation, or give me the notes, like what was the doctor's name, what was the date and time of your phone call. You don't have to really dig down and get like signed paperwork. Just kind of get a sense that they've got some backup for you. And then they qualify. They have symptoms and they were seeking medical guidance. That's it. You don't need a positive result. You don't need a paper that says they have it. They qualify. Now, also, if somebody does test positive, that's it. They qualify. So, you have these little breakdowns in there that you have to, really kind of understand how that is. And right now, there's a lot of good faith effort out there. You got to trust your employees. You have to trust that they're going to be upfront with you. You're going to be transparent with them. And communication is really important. You don't need that doctor's note, but you kind of do need a conversation. And that's why some of you I know already have this form, but we've created a great form. And it's really simple because it just says, I have symptoms. Here's my doctor. Here's when I talk to them. I'm requesting leave for sick pay, whatever it is. And we've got an employee signature line on there. That signature line says, I acknowledge that what I'm telling you is true. And that is more valuable than anything else you're going to ask them to give you. So we would encourage you to use some type of form. If it's not our form, get some form where you're just basically having them fill out, this is what's going on. These are the dates I'm going to be out. I acknowledge I'm telling you the truth. And that's all you need. That's your backup.
So it's
if you guys don't have that, we'll send it to you.
Same exact scenario, but the person being tested is, let's say, a 7-year-old kid instead of the parent or the actual employee. Is that where it comes into the 2/3 eligibility? Or
yeah, so if you've got a young child who's home because they've got symptoms, then you're eligible for that 2/3 pay because you're caring for an individual who is sick or has test positive.
Okay. Thank you.
Rachel, I have a couple of questions come through, and you touched on this one, but I just want to clarify. Somebody asked if somebody has been off already for one 14-day period, either because they were sick or they needed to quarantine, but then they come back to work and they're working along, and then they need to be off a second time, either for their own health or to look after somebody that needs care. Does that count as using towards the 80 days or / the 10-week period? And then on the back of that, they asked if somebody was to use their own sick time or PTO the first time they were off, is the 80 hours still, if you will, in the bank to call on should they need it to be off a second time?
Okay, so there was like 6 questions in there, I think. But I'm going to get them all.
If you're going to come to it, then by all means move on, and we'll just circle back around. I just know that you'd mentioned about using it intermittently, so I thought now might be a good time to ask.
Yeah, we are going to come to that, but let me see if I can go through it. So, first of all, I want to comment on the using PTO first, because you don't want to do that. One of the very specific line items in the FFCRA is that you cannot require your employees to use PTO. If they are eligible for FFCRA, FFCRA is first. And so then, let's say under Amanda Jo's example, you've got somebody who was out sick or was positive for COVID for the full 80 hours or for the full 2 weeks. Then they got well, they returned to work, and now they're sick again, maybe even test positive again. They've already used the 80 hours. So they are no longer eligible for any of that sick pay under the 80-hour window. That's it. However, let's say that person used their first 80 hours because they were sick. They tested positive for COVID, out sick. And they got well, they came back to work. But their child, who's in first grade, is not returning to school because her school is not opening to brick and mortar. They're only doing virtual. And she now has to stay home to care for this child during the day. She would be eligible for that 10-week extension for 2/3 pay under the EFMLA.
Thanks, Rachel.
I think I got them, but we'll talk more about that as we go through. So here's a couple of no scenarios. Like I mentioned, a 16-year-old who's healthy under normal circumstances, they've got a summer job down at the local store. Well, the store is canceled or the store's closed due to COVID. That 16-year-old is not a child who requires care. So now that the child is not going to their summer job and they're home playing video games or board games or whatever they're doing, that doesn't mean they need care. So your employee would not qualify for that expanded FMLA for this child. Your employee has a spouse who is a stay-at-home parent or is already home due to a layoff. And now, because I said you have to be the only parent available, and in this example, you've got another parent who is available, and therefore your employee would not be eligible. This is kind of an important one. We've had this scenario quite frequently, and it's about communicating with your employees. So without knowing too much about what's going on the other side, you know, you have to kind of approach this one carefully. And when you know that your employee is saying, I'm the only parent, then you have to trust that. Even if you know otherwise, if they tell you, I am the only eligible parent to care for this child, then they're going to qualify. But you want to kind of, same thing, get that form. Ask them to write it on the form. I'm the only parent available to care for this child. My spouse has a job where he cannot stay home. He's an essential, he or she is an essential employee, or whatever the case may be. Get them to fill it in that form and get them to sign it. And that's what you can do. So I did some more, like we talked about some of our examples already. But when we talk about, like, where does the pay come from? How does this go? Okay, so you've got, like we already talked about this one, your employee has the flu, your employee, you say stay home, flu-like symptoms, anything on our list, our symptom list is getting longer and longer, but and the employee is seeking medical attention. So right there, you know, they have symptoms, they're seeking medical attention, they qualify for FFCRA. Now they get, 4 days later, they get a lab result of negative. Well, it doesn't matter what the result is. They were out with symptoms and they were seeking medical attention, they qualify. Really simple. The employee is well, but does not feel comfortable coming to work. So they're not eligible for FFCRA, they're not eligible for unemployment, but you may talk about taking an unpaid leave of absence, using PTO, using whatever vacation time they are eligible for. You can use other means or make other decisions, but they won't be eligible for FFCRA or unemployment pay. So here's another example. My bar has been ordered to close, and I have 2 employees at that time who are currently out on FFCRA sick leave. Well, as soon as the bar is ordered to close, those employees are no longer eligible for FFCRA. So they would switch to being furloughed or laid off. So they would immediately be eligible to apply for unemployment. If you're closed, you're not paying FFCRA. You're only paying FFCRA if you're open, operating, and the employee can't come in. Are we good? Okay. If an employer is temporarily closing due to lack of business, simple. Your employees are furloughed or laid off. They are eligible to apply for unemployment. And then here's our example from earlier. Your employee has already used 80 hours of sick pay due to COVID, and now they're sick again. And this, remember, this bill is in place until the end of the year. So somewhere down the road, November, December, they test positive again. They are no longer eligible for FFCRA paid leave because they used their 80 hours, but you can then pay them using your paid time, your PTO or your vacation or even unpaid time off. So FFCRA will always be first. And then once that's gone, then you can talk about what do you do? Is this considered unpaid time? Maybe it is. Do you have a PTO platform they can use? Do they have vacation time available? Do they have sick time available? You can use those other pieces after. And then I'll also throw in there, I mentioned it earlier, but if the 80 hours is based on the average, so it's not 80 hours automatically, it's based on the individual employee's average hours worked. So if you have an employee who only works 30 hours each week on a regular basis, then that's what they're eligible for. So it's not automatically 80 hours for that employee, it would be 60. So they work 30 hours in the first week and 30 in the second. So it's not, the hours aren't the fixed hours, it's based on an average for the individual employee. And so by the same line, I want to talk about the pay. The pay is also an average. You will look back 6 months and create an average per hour number for your employees. You want to add in their hourly rate, tips, bonus, commission, anything that you pay the employee in a 6-month window, and create an average with that. And that's what you're paying them. How we doing, guys? Your head spinning yet, or are we good?
I'm getting a lot of, oh my gosh, in the comment. But,
sorry.
No, it's, this is incredibly helpful, Rachel, thank you. One question that came in, so is the FFCRA pay taxed as regular pay? Is the direct question. Yes,
so all of that is as it normally is. And so then, but like I said, remember, you take the employer's portion of that Medicare tax, that's part of the credit as well. Yeah. Okay. Can I require my employees to get tested before they return to work? This is one of our favorite questions. Really, it's a bad idea. No, we do not want to do this. Technically, yes, you can, only if that position poses a direct health threat to others. And so you want to be very careful. We really don't want to enter any kind of arena where we're creating mandatory testing. So my first answer for this is do not do this unless the particular position creates a direct threat. So you want to think in terms of discrimination here. You have issues, you have ADA, you have things that you want to be very, very careful about here. And so if somebody's out, you can't require them to take a test before they return. But if the position they're in and everybody in the same position is required to follow the same steps, then you might be okay there, but be very cautious about it. My first thought is don't do it. It's too dangerous. It's too risky. Don't open up the exposure for yourself. However, if there's a direct threat to others, then make it a policy for everyone in a similar position, and that will protect you. All right, this is a real live example that was really hilarious, not so much. But your employee had a gathering at his house over the weekend, and 10 coworkers were there. First of all, why? Stop doing that. And second of all, on Monday, the employee starts to have symptoms. He's got a cough and a fever and a sore throat, and he just spent, 5 hours in a small apartment with 10 coworkers. So down went the rest of the team. So again, these are real examples. We talked to one of our clients. They only had 50 employees to begin with. 10 of them test positive for COVID. 8 were in the hospital. 10 more beyond that were afraid to come in because of the other coworkers being sick. And so they had nearly half of their workforce out of commission, and they had to cancel jobs with clients. So it put them in a really bad position. So you have to be, as an employer, you've got to be responsible. You have to have conversations, educate your employees, encourage them not to gather. You can't require them to not gather. What they do in their time is their time, but be proactive and educate them, inform them, ask them to take precautions. If you guys are wearing masks in your office and you're creating social distance and you're following CDC guidelines, remind them to do that in their own lives as well, because it will benefit everyone. So in this case, can you quickly set up people working from home? Can you keep people working from home? Can you create social distance at work? Follow the CDC guidelines whenever you can. The recommendations are good and can help kind of spread this out and slow it down. And so educate, inform, encourage. Then you've got the people who are like, masks are dumb, I don't want to do it, or whatever. Just like tell people like, I don't care, it's fine. Everybody has their own view, but this is what we're doing here. We're going to be following the guidelines. We're asking people to wear a mask in our building. That's what we're doing. And then just keep encouraging that, and it will have a positive impact. Hopefully not positive for COVID.
Rachel, quick question that came through. In this type of scenario, if somebody has had COVID or has been tested, suspected they had COVID, can the employer require a doctor's note stating that it is safe for that employee to return to work?
So again, the CDC is asking us not to do that. They're saying reserve the staff in the medical field to care for people who need medical attention. If you're just asking for some document that says they're safe to return, it's potentially going to waste a healthcare provider's time. Now, having said that, they may have a conversation with a doctor and they can just say, my doctor told me it's okay to return to work, or I had a conversation with my 1-800 teledoc and this is what the conversation was. So ask the employee, what did your doctor say? And go from that information. If your doctor, if you're concerned about having somebody come back to work, pay attention to the symptoms. The CDC has some really set guidelines where you don't necessarily need that note, but ask, have you had a fever in the last 72 hours? Are you still taking medication? Are you medical free at this point? Normally, we would never ask these kinds of questions of our employees. However, because we're in a pandemic, we have some loose guidelines here. So you're allowed to ask that. Can you please tell me if you have any symptoms? Have you had a fever? Do you still have a cough? Are you exhausted? Ask about the symptoms. So if you know somebody was out and test positive for COVID, and now maybe they even went and got a negative test result, like, hey, I went on Monday, I got my results back, I'm negative. I haven't had a fever, my cough's gone, my energy's back, I'm feeling great. Then that's all you need. You don't need a note that says this person's okay. You need evidence and a conversation, and that will get you a lot farther.
Would you say the same thing would apply to kind of second question come in to say, if somebody has an employee that's traveled to an event in out of state, and then when they would return to work, is it really a conversation to say, have you had a fever, or is there sort of set guidelines as to, well, if you've been to this particular state or that particular state, then you need to quarantine?
Yeah, and again, we've got people who are using a daily questionnaire so that, every day before somebody comes to work, they answer a series of 4 or 5 questions. Have you had a fever? Do you have any symptoms? Have you traveled to a state that has high numbers or whatnot? And so it's okay to go through that checklist on a daily basis with each person. And maybe it's a text message, maybe it's a form that you have them check boxes, maybe it's just, if you can answer no to all these questions, come into work, whatever it is, but it's okay to use a questionnaire on a regular basis. We would definitely encourage that. And with the travel, I kind of touched on it before, but there are some states that have specific quarantine guidance in place right now. I think it's like other states have it about Florida, but I'm not really sure. There are some places where the actual guidance qualifies as FFCRA paid leave, because you're told directly, if you travel to this X state, then you are required to quarantine for 14 days upon return. If that is in place for a state where you've traveled, then you would qualify. So let me give an example. let's say somebody goes, I know, is Texas one of the quarantine states? Does anybody remember? I think Texas was on the hot list, like Florida, not so much, but like if you travel to Texas and then you go back to Georgia, you might have a 14-day restriction in place. I'm making these up, but there are these in place. So let's say my employee goes on vacation to Texas and they're using their vacation time for a week. And now they come back to Georgia where I know we've got requirements in place for self-quarantine. Now, upon their return, they've been told to self-quarantine because they traveled to a state with high numbers. So they would be eligible for 80 hours or 2 weeks when they return from their week vacation. Now, it's an unusual situation, but that is an example where that would fall into place.
So Rachel, a couple questions that came in based off of that, and thank you so much for answering all these. One is, in the language of the bill, there is a hardship exemption that it states that you could apply through the Department of Labor if you have less than 50 employees. And the wording in that initial bill is if it would essentially close your business, is kind of the way it is. If it creates a situation where by doing so, you would be putting your business at risk of closing. And a lot of the people on our call today have less than 50 employees. Can you explain a little bit about what that process is and how they should handle that?
Yeah, so the exception is not for the 80-hour window. That 80-hour sick pay window applies to everybody without question. The exception only applies to the expanded FMLA portion. And so when you look at that extra piece, and that's saying that if I allowed my employee to stay home to care for their child, it would shut me down. It has to be that dramatic. There are not too many examples where that applies. So again, that 80-hour piece is not part of the that exemption language. It only has to do with the expansion piece. And again, the expansion can be used intermittently. They've created it so that you should be able to do that. I will give you an example where the exemption did apply, and we actually help them. There's no paperwork. You don't apply for it. You don't send a letter to anybody. If you believe that you are somebody who would qualify for that exemption, you simply write that in a memo. You describe why that is the case, and you save that for your files. So an example where this was the case, we had a client who they have live inventory. They were farmers and they have nursery plants and all of their products in the greenhouses. The employees who work in those greenhouses are highly skilled and require months of training to get into that position. So if those employees were not there, they did not have the ability to train and get anyone up to speed, and all of their inventory would die and they would go out of business. So that is an example where that extreme hardship, being without those employees, would cause them to actually go out of business, and therefore they were exempt from that expansion piece and only the expansion piece. So another piece of the expansion provision is that you're saving a job for that person. So even though somebody is out on that expanded FMLA provision, you're also obligated to hold their job for them while they're out. Meaning you can't just say they're out, I'm going to replace it with somebody else. You can have somebody else do the work while they're out, but as soon as they can return, you're also obligated to put them back into that role. Now, there's another exemption if you're under 25 employees, and during the course of the time when the individual was out, if you had to lay off that position. So during the course of that window, you have less than 25 employees anyway. During that course of time, that position no longer exists. In that case, you would be exempt from replacing that employee. So that is another small exemption piece that's in the language of the bill. We good?
One question, which you talked about, was when you say an employer's tax is not payable, which tax are you referring to? Unemployment tax, state, federal? Is reading that question directly.
The employer's share of Medicare. Yeah. Okay. So let's do a couple more scenarios. What if my employee's spouse has tested positive, has a positive case in his office? So you see the layers we're building. You've got an employee, your employee's spouse works in an office, and there's a positive case in that office. It's not a whole lot for you to do. Encourage social distance in the workplace, out of the workplace. Inform your employees of your safety protocols. Have a safety protocol. What are you doing to create social distance? What are you doing to create a safe environment? Follow the CDC guidelines. All of your employees in this example will continue to work, and use the questionnaire that we talked about before. Create a questionnaire. Ask these questions before every shift, before every day. We get the question about taking temperatures. And yeah, I know there's some places in South Florida where you're obligated to take temperatures or whatever, but it's kind of pointless because taking temperatures doesn't tell you that much information. It tells you if the person has a fever. And so having a fever may mean the person has COVID-19, but it's not a guarantee. Having a fever doesn't mean you have COVID-19. And at the same time, not having a fever doesn't mean you don't have it. So taking temperatures is a little bit of a waste of time. If you are in one of our counties where it's required, follow the guidance of the county at this point. But as soon as you don't have to do that anymore, don't waste your time on it. It's not really going to tell you anything. Ask your employees, ask them. Have you had a fever? Do you have a fever? And if they, if somebody has a fever, they don't feel good. They're going to be able to tell you, yeah, I've got a fever. If they have a fever, go home. That's it. It's pretty easy. I know that this isn't a PPP webinar, and you can find other PPP webinars. I was telling Katie about it this morning. Please go to the CertiPay website under the News tab and get a full PPP webinar. But I wanted to say a couple things about it. So here's some examples. We got the PPP loan. We already used all of the funds, and now we have an employee who's out with COVID symptoms. So that's okay. Your PPP funds are separate, and now you've got somebody who qualifies for paid leave. They qualify, and you still get that tax credit because the PPP funds are separate. The way, the guidance from the Treasury Department on all of these tax credits is don't stack anything. Be very careful not to double dip. That's the only thing they're really looking for, so be careful here. So now in the example of we're in the middle of our covered loan period, and 2 employees test positive for COVID. Well, technically they would qualify for FFCRA, but you're already using loan dollars to pay their wages. So don't put them under the FFCRA piece. Just pay the wages with your loan dollars and then save that FFCRA piece for down the road if you need it. But only use one set of dollars to cover those wages. Good? Okay, so documentation, a lot of this we've already talked about throughout today, but you don't really need to ask for proof. Just ask the employee, ask for information, and they don't need to show you proof, but if they tell you information and fill it in that form, it's okay to ask questions about symptoms. It's okay to ask, did you call a doctor? Did you go to a doctor? It's okay to ask the questions, but we don't want to send them to get extra documentation. It doesn't really change anything. CertiPay has a great request form, like I mentioned. I'm happy to send it to you guys. I think Amanda Jo already has it. I think Katie has it. If you guys need it, we'll send it out, no worries. Get the employee's signature on that form, and it has a disclaimer. I acknowledge that everything I'm telling you is true to the best of my ability, blah, blah, blah. Get their signature on that. That's more important for you and more valuable, because then you have a documentation that they are telling you the truth. If you find out later that it was all made up or not, now you've got a violation of your company code of conduct or a violation of your handbook where, you know, they're not being truthful about something. So you have, that's your proof, is the signature on that form. You got to dig deep right now. Trust your employees, trust what's happening, and like I say, just do the best you can. Kind of my final thought, same thing. Remember that FFCRA is in place for the rest of the year, and the 80 hours is a one-time shot, whether they use it for sick pay or childcare or whatever it is. That first 80 hours is that one-timer. The extra 10 weeks are specific to childcare. Document as much as you can. Just write everything down. With FFCRA, there's nothing to turn in. There's no application. You're not sending it to the DOL. You are documenting for yourself. And then when you prepare your 941 and you are claiming all of these tax credits against your 941, keep that documentation to show the backup of the credits that you apply for. And do the best you can. You know, these are crazy times. We're all in this together, and we're all doing the best we can. So if you're not sure about something, reach out to CertiPay, reach out to the chamber, and we have your back. We're going to help you guys get through this no matter what.
Awesome, Rachel. And you have been incredible, and we're so blessed to have CertiPay right up the street from us in downtown Winter Haven with you know, hundreds of employees in our downtown core, and we certainly appreciate that. I did have one question that I saw come in, that was when you talked about a direct threat, the kind of that statement as being a direct threat, if the employee's in a role where there would be direct threat. Does working directly with children, this is the question, does working directly with children qualify as a direct threat?
It can. And so what you want to look at there is, can you don't want to ask one person and not everybody. So let's say you're an educational facility. Can you feasibly require every one of your teachers to go get tested? Because if you're asking them to do it, now you're going to pay for it. And it's going to be extra time. It's going to be all these layers. So in that example, you know, you've got people working with kids that could qualify, but asking everyone to do that may not be financially feasible. So you want to kind of weigh that out. Does it make sense to send everybody for testing, or just ask everybody about symptoms?
Okay. And then a question that came in was, obviously this bill specifically for employers with less than 500 employees. And forgive me, it's been months of different bills, so I'm trying to remember, but public sector government entities, whether they're above or below 500 employees, are they included in any of this?
Yes.
Stuff, or?
Yeah. Sorry, I didn't mean to cut you off, but yes, any employer with under 500.
Okay, so if an employer has over 500, there's nothing in place for that right now?
That's right. There isn't a fixed leave bill in place for that, no. And kind of the concept is an employer with more than 500 employees probably has a pretty good PTO or sick policy in place. And so those PTO plans and sick policies will be used in this case, but for employers under that, they may not have that in place. And that's the concept behind this one.
Okay. All right, guys, are there any, I think I've hit all the questions in my queue. AJ, do you have any questions in your queue right now?
No, we covered them all. Just lots and lots of thanks and appreciation, Rachel. Thank you so much for doing this, and lots of comments from everybody that was on there, how useful the information is.
Yes, and we will. I've got quite a few people that have asked, will we send out the recording? So yes, we'll send out the recording, and any information, Rachel, that you're willing to share, we'll send out the form that you mentioned. But again, thank you to CertiPay for helping us with lots of questions through this
Absolutely.
last 5 months. So Rachel, thank you for being very generous with your time. We really appreciate it. And thank you to the 35 members that logged on today. Hopefully you can help your friends answer some questions, but please let anyone that asks you, we'll have this up on our YouTube channel, and we will also send out the link to the CertiPay news feed where they have a lot of helpful webinars related to COVID and many other things as well. So.
Absolutely. Thank you so much.
Right.
And thank you to Kim Harris from CertiPay. She's your connection through the chambers. So if you guys have questions, you can always reach out to Kim.
Yes, we love us some Kim Harris. She's on here. Kiss, kiss. But yes, and someone, Rachel, you'll love this. Someone just commented, I need a Rachel. So we all need a Rachel in our organization.